Let's discuss the skeletal muscle of the forearm. Before we get into it, there are so many muscles in the forearm. Don't worry, we're going to compartmentalize it. We're going to go over some of the high yield points, but be aware that there are so many muscles in the forearm. They're going to be located here, but they're really going to be playing a role in terms of the wrist and the hand. So let's start with the anterior side of the forearm, and these are going to be the flexor muscles. So they're going to be located in the forearm, but they're going to flex the wrist and flex the digits. There are three main layers, and we're going to start with the superficial layer, and these muscles in particular are going to attach to the medial epicondyle of the humerus via the common flexor tendon. Now, I want you to look real quickly again. Let me get that out of the way. Let's recall the medial epicondyle in comparison to the lateral epicondyle. Which one is going to be considerably larger? As you can see here, it's going to be this medial epicondyle. So if you think of which muscles that you're using more, so if you think about flexing your digits and flexing your wrist, you're doing that a bit more and with more force than what you're doing on the posterior side with extension. So that's why you're going to have this larger medial epicondyle. Another thing that's going to be common for these anterior muscles are that they're going to be innervated by the median nerve. Almost all of these muscles, with the exception of a few, which are going to be innervated by the ulnar nerve, almost all are going to be the median as it travels to go through the carpal tunnel, so before it travels there. So let's talk about the superficial compartment. The two main muscles that I want you to know are your flexor carpi radialis and your flexor carpi ulnaris. And these muscles are very fortunately named. Flexor, we know they're going to play a role in terms of flexion. Carpi means wrist, so they're going to flex the wrist. And then radialis and ulnaris are telling you on which side they are. So you have your flexor carpi radialis here on the radial side, and then your ulnaris is almost hard to see in an anterior view, but it's going to be attaching from the ulna to bones associated with the wrist. So flexion, they're playing a big role there. Also, they're going to play a role in terms of abduction and adduction of the wrist. So let's talk about which one's which. So if you're in anatomical position, abduction is going to be going laterally. Adduction, you're moving back. All right, so abduction, adduction. Now, if you move those muscles out of the way, and you can even see it a little bit with the tendon still there, you're going to have your flexor digitorum superficialis. And this is a very wide muscle, one of the largest muscles in this region. And you're going to have a flexor digitorum superficialis and profundus. Profundus will be deep. The biggest difference between these two muscles are their distal attachments. Flexor digitorum superficialis attaches to the middle phalanges. So that means that they only will play a role in terms of the PIP, not DIP. So not distal interphalangeal joints, only the proximal interphalangeal joints. They'll also play a role in terms of flexion of the MP, or your metacarpophalangeal joints. And let's look at this flexor digitorum profundus. Very similar in terms of shape of the superficialis, and they're going to have a distal attachment to the distal phalanges, so those very furthest or the most distal of your phalanges. So they play a role in terms of the MP, PIP, and DIP joints. And of course, as the name would suggest, flexion of these particular joints. Now, there's one muscle that hangs out in this region that is kind of in between. You see it better on the anterior side, and it also plays a role in terms of flexion. This is your brachioradialis, and you can really palpate your own brachioradialis fairly well. In terms of its muscle belly, it's fairly expansive. It will weakly flex, and you see it better on the anterior compartment, but it's often associated with the posterior compartment because of its innervation. So, whereas it flexes, it's still going to be innervated by that radial nerve. Now, if we were to reflect away some of the muscles, you can see the strongest of your pronator muscles. So basically all the muscles have been removed. You can see the interosseous membrane right there. And your pronator quadratus is going to be the strongest in terms of pronation of your proximal and distal radial ulnar joints. Obviously, this one's affecting the distal. You also have a muscle that's going to be more superior, or excuse me, more proximal, which is your pronator teres. You can see that right here. So closely associated with that superficial compartment of the anterior forearm. Now let's move to the posterior side. So when you're thinking posterior, similar to what we thought with the arm, so that triceps brachii, remember, is the extensor of the forearm or extensor of the elbow joint. Well, on the posterior side of the forearm, those muscle bellies are going to extend your wrist as well as the joints associated with your digits. And these are going to have, or most of these muscles are going to have a proximal attachment to this lateral epicondyle right here. So recall, there's your medial and more robust medial epicondyle. As we discussed before, radial nerve equals posterior. So all these muscles on the posterior side are going to be innervated by the radial nerve. And you can see here, this is a more superficial picture here. And you have a very similar organization as what you had on the anterior side. You have your carpes, so that has to do with the wrist, as well as abduction and adduction. So ulnaris obviously is going to be on the more medial side. And then you actually have two separate carpi radialis muscles. You have the longus and the brevis, but they're playing a similar role. So we're not going to get into all the separate muscle names for the extensor compartments. They're similarly organized. Typically you just have a superficial and a deep compartment, but they're playing a role in terms of extension of the wrist as well as the digits.